of March, I went down to Florida, and down there at a little weekend conference, and I ended up getting a scratch on my face. It got infected. I came back, it was red, and it started spreading. I turned to cellulitis. So I haven't taken a prescription medication in 25 years or more. But I got a buddy who's a DO, and this thing was taking off. I was trying everything, didn't work. So he gave me some ciprofloxacin. Is that how you pronounce it? Yeah. So I started taking it, and it started clearing up pretty good. But I started taking it on Tuesday evening. Saturday morning, I took a dose, and I didn't feel right, like right afterwards. So I went to the office. We started seeing patients at 9, about 8:45 to 9. All of a sudden, it felt like somebody stuck a meat hook in my gut. And I never had pain like that before in my life. I turned white, started sweating. Peggy looked at me. She called EMS. They showed up. My vitals were pretty good, but my heart rate was really low. So they looked at me, and the guy says, I don't know you, but you don't look good. I don't feel too damn good. You know? So off we went to the hospital. You know, the lights flashing, the siren blaring. Like, they're waiting for me when I get there. I don't know what they think's going on, but I'm not feeling too good about this at this point. So we get in there, and this female doctor comes in, and you know, you can't lose your sense of humor, right? She says, "What brings you in to see us?" I said, "Well, it was a red truck with red flashing lights." She said, "I never heard that one before." I said, "No, really?" Anyways, they start doing my blood work. Well, everything is coming back perfect. My liver enzymes are perfect. My cholesterol is perfect. My blood sugar is perfect. Until they check my lipase. Now, lipase, you know, normally runs 65 to maybe high end 400. You know, mine was 48,000. So the doc says, "Well, we know what you got. You got pancreatitis." So, and then he says, "Well, the only treatment we can do is we got to completely rest your pancreas." So you plan on being here at least a week, maybe more. He says you'll have nothing by mouth. He says you can't even have ice chips. So they took me up to the what's that step down ICU, Melissa?
Mm-hmm. Yeah.
I didn't realize that till you told me that about a couple weeks ago. That I thought I was just in a regular room. I don't know. Anyways, we get up in the room Saturday early evening, late afternoon, and I'm thinking my pancreas is really inflamed. It was caused by the Cipro. So I said to Peggy, I said, "What worked better than anything else on inflammation?" I said, "Go get the machine." So she goes back to the office, she grabs the machine, she wheels it into the room. Nobody's there, so we plug it in, and I start treating myself. So I do that starting Saturday evening. Sunday morning, they take my blood. My lipase went from 48,000 to 4,600. So that was cool. That's, you know, I'm still in a lot of pain, but the Dilaudid works really good. That's good stuff, you know. That was Sunday. Monday they took my blood. My lipase was 850, and then Tuesday it was 275, and that's when I came home. But Tuesday morning, 3:30 in the morning, this nurse comes in, and she was the first time I'd seen her. I'm awake, she walks in the room, she's giving me pain med. And I said, I'm kind of wake up, and I said, "You know, would you do me a favor?" I joked with her or something. I said, "Would you do me a favor and help get this machine going so I can treat myself?" I said, "It's really easy, I'll walk you through it." She said, "Sure." So she does, hooks it up, and I take the loop, and I just have it over my gut here. And then she starts asking me questions like, "What is that thing? How's it work? How'd you get it in here?" You know? So I'm telling her how it works and what it does, and you know, it's going. And I said, "You know, we've treated patients with everything from autism to zits, Parkinson's, MS," and she stopped me and she says, "I have MS." And she went on to tell me she was 35. Forgive me for releasing your age. She was diagnosed when you were 22, 23, and she was really kind, you know, I could sense she was scared because she can't feel with her fingers, and you know, you need to do that kind of, to put in IVs and stuff. So the machine went off, and I said, "Well, you know what, if you sit in that chair over there, you're going to treat yourself." And she said, "Really?" I said, "Yeah, that's kind of weird." I said, "Well, sorry, it's 3:30 in the morning, what the hell else are we going to do?" So she sits in the chair and put the light, I just had the large loop there, and I put that around her neck, and I had her set the intensity, and she's going like that a little bit. And I said, we set the timer 5 minutes. I said, when it goes off, push the button, and do it again. So okay, so at which point that the lot has really got me kind of like this. So I kind of close my eyes, I hear the machine running, and I hear it stop, and I hear it run again. And then I hear it go off. And I open my eyes, I look over, and here Melissa's sitting here going. She's touching things, and she looks up at me, and she's got tears running down her face. And she looked up and saw me looking at her, and she came over and gave me a big hug, which was pretty cool for an old guy at 3:30 in the morning. But anyway, she said, I haven't been able to feel my fingertips in 10 years, and now I can. It was just, I knew at that point that somebody put me in that room with that machine at that particular time for that to happen. But I want you to meet Melissa. Why don't you come up, Melissa? Did I tell everything okay?
Yes.
Yeah, pretty good?
Yeah.
Anything you want to add?
No, not really. I mean, it really was an incredible experience. I mean, he's absolutely right. That whole thing was meant to be that night.
Yeah.
Meeting him that night and seeing him with that thing on his belly and what were you doing? Like, and it blew my mind that nobody else prior to
3 days.
3 days he'd been there had bothered to question what he was doing, what was going on, and nobody. I mean, really, nobody, not a single person. So, you know, I guess I was the beneficiary of that, so that was a good thing. But yeah, in all honesty, 10 minutes time, and I had a feeling in my fingertips. I haven't had it in 10 years. So.
Besides being a chiropractor, I'm a college and high school basketball and soccer official for 20-some years. Well, I had failed left knee medial meniscus second time surgery in March after tearing it during a basketball game. From March all the way to November, I couldn't walk in my office without pain, let alone run. So I was done running, done everything. And Ron one night called me and said, this guy named Joe's coming to my office. Come on over, you'll be his last patient. So I sat down, he treated my knee for 6 minutes. I got out of the chair, I had no knee pain for 2 days. I was shocked. I went back, the following week Joe was back again, treated again, no knee pain this time of week. I think it was about 4 or 5 treatments, totally gone. I'm back running, officiating, and the story goes on from there. But I'm the type of person that I just don't take someone's word on a machine or like that, so I want to do research. So I called, I said to Joe, come to my office. I'm going to bring in 10 of my worst patients, and I want you to treat them. And he did. And every one got better. Anyway, I've been using it since, well, a year and a half or so, and tremendous results. 2 cases. One, my wife was diagnosed with Parkinson's disease. How long ago? Couple, 2-3 years ago. Sorry.
Okay, right, man.
We put her on medication, and let me come back to that story. I have another patient, 75-year-old lady, is referred to me by Tom Bice. Anybody know Tom Bice?
Yep.
Okay. Tom is our chiropractic guy, okay, and so on and so forth. How do I know him? I know very well. Anyway, this gal comes into his office. She's paralyzed on her right side. They drilled a nickel-sized hole down through her head to get a pituitary tumor out, and told her that more likely she'd have paralysis. So he said, go see Dr. Warren. He might be able to help you. She's become a very, very good friend. We started treating her last October. She's now in Canada. They have a summer home in Canada. We now have her walking. She can move her arm up and down, leg up and down.
Amen.
Sweet, sweet lady, okay? Going back to my wife, we started treating her after she was diagnosed. She was on medication. I cannot think of the med, was it?
Cinnamon.
Cinnamon, thank you. And so we started treating her in December. She was on the medication for a while. January 1st, unbeknownst to me, she stopped taking the medication. and didn't tell me until March 1st. So 2 months, no medication, no symptoms. Treating every 2-3 days we've been treating her. It's now been a year and a half, no medication. I was telling the doctor that we go every 6 months to the specialist in Grand Rapids, Dr. Newman, who's a Parkinson's specialist, probably one of the top in the state of St. Mary's. And our last visit, he said, I really don't even know if you have Parkinson's because I expect you to be worse by now. So we ended up having a DAT scan, which we just talked about. And the DAT scan came back negative, meaning supposedly she doesn't have Parkinson's. But the DAT scan, as we've just talked, cannot always be read correctly and is not, I don't know what the percentage of correct diagnosis for that. But anyway, I can go on and on. I've got other cases and so on and so forth. But it's been phenomenal. So,
my mom.
This is Chrissy here.
Hi, Chrissy.
Hey. My mom is been studying health for a lot of years, doing it naturally, and she's been doing cleanses and doing more cleanses and getting down to the roots of a lot of different issues she's had going on. And I am studying to be a naturopathic doctor, along with a lot of other modalities. And so I've been kind of going down that road with her for several years. And she has a tendency to be a little on the nervous side, and nervousness causes acidity in the body. And when you have a perfect storm of detoxification, acidity, and then not eating properly because you're a nervous wreck, that can cause a storm, which came up with literally the blood was boiling to the point where it started appearing outside the body, in the skin. And so she had acid burns that went from her hand all the way to the back of her neck. And we had treated that through some things that I had learned from her and through what I'm learning in school, and we have gotten it to the point of healing. But one problem with that is that the nervous system is greatly affected, and I have not learned enough about that to really effectively deal with that, and she has a lot of allergies, so you can't go just any old way with it. And so Jack and I had been talking at church, and he had been telling me about this machine, and I really had an interest in it. I just hadn't had the time because I'm a massage therapist too. So I've got 4 hats I'm wearing, and getting to him is a whole nother story. But he gave me the information, I looked it over, it looked good, and as my mom progressed in her healing, she was able then to get outside the house and do some things because it was very bad. It just totally, she was almost paralyzed. And to see my mom like that was enough. And so I handed her the booklet. I had already got I really felt like an impression from God that I needed to do something about it. So I started taking her to him as soon as she gave me the okay. She's been on 2 treatments. She has phenomenally, she can touch her arm. He took video of it and how well she's doing. And she's a completely different person. She's gained 6 pounds, and this has only been in 2 weeks. 2 weeks, and she's gained 6 pounds. She had went down to 108, and she weighs she's about the same height I am. She's a little bit more frail, but she's 72 years old, and she's got a lot more to do. So she's like, I need to get over this, you know, and you can't do that by yourself. And in the nervous system, you truly have to have something electrical, something that's going to go on those neurons and travel the neurons in order to affect it. And she's doing phenomenally. She would have been here today if she needed just a little bit more time, maybe a little bit more encouragement. But she's really excited about this, and so am I.
I had a patient who's 62 years old, diabetic, 330 pounds, and having Charcot's joints breaking up, and they told him to prepare himself psychologically to have his feet removed. And so I studied. It's a cousin of mine, and fortunately he's only like 10 minutes from my office. So at lunch I was going over, because he was housebound, going over to his house, and I would just, I would treat him through his cast. His left foot was in a cast, and he had,
I just want to make sure I got it on the video.
pins and 8 screws in his left ankle. And I treat him he got well enough that he was able to. I mean, it took months. I started treating him in January. In April, he started driving to the office, and they had designed him some boots that transferred the weight to his upper tibia, and he couldn't wear them. They were too inconvenient. So he's been walking from the parking lot in my office without his braces on. And I mean, his orthopedic surgeon said, "What the hell did he do?" And I said, "Whoever this guy is, you better thank him, because we're going to take that one off. We're going to get the other one too. You were going down." So, I mean, you know, he's got before and after x-rays, which I'm trying to reprint for posterity. But,
For all posterior.
Yeah, for all posterior, yeah. But anyway, I mean, this guy's doing much better, and he tries to come in twice a week. You definitely have to, stuff like that, you got to see.
88 years old, lives by herself, gets around pretty good, but she tripped coming out of the bathroom on a threshold, smashed her nose, big bump on her head, really, it looked like a raccoon that didn't make it across the street, and stitches, all kinds of stuff. So after we got her out of the hospital, she came to my house and stayed. That's another story. Anyway, so I started treating her, and I treated her twice a week for 3 weeks. And you can, I'll show you, some of you have seen this, but it is amazing. And the doctor said, "Is this the same person?" They couldn't believe. I mean, bruises and stuff like that, swelling.
You're just doing the loop?
Doing the loop, yep, that type of thing, yep. And actually, we did some other parts of her body, so she got range of motion and everything else. It was just amazing. And I had to take pictures because I wanted to prove it too, you know, and that's what it's all about, you know, I mean. And I've got another one, you're looking at that.
Oh, you copied that. That's amazing.
I have
That's on my website, I think.
Or is that one on there? I don't think that.
Oh, we can get your copies.
Okay.
I had a guy that came in to me. I do inventions, and I help people with inventions and ideas and stuff, or at least I try. And he came to me with an invention, and he had this idea, and so we were talking about it. Then I noticed him limp. I said, "What's wrong?" "Well, I was in the Army, and I got this thing in my hip, and I've been discharged medically 5 or 6 years ago." He said, "I've been going through Bethesda and all these other places for years, for just to see if I can get this thing fixed." So I said, "Well, let's give it a treatment." So I gave him 2 treatments. And after the first one, he started feeling better. He says, "It's like a sharp screwdriver in your hip." And I said, "Well, that hurts." So after about 2 treatments, he comes in, and I'm videoing. I did another video. I said, "You don't mind, do you?" I said, "It doesn't matter because I didn't charge him." So I'm not a doctor, so I don't know anything. So anyway, that's how I learned. That's why I know this thing works. So anyway, so he says, "Look at this." This guy, he said, "I can't believe it. I haven't been able to do this in years since I've been in the service." And we're also talking to people about possibly getting this into VA, which desperately needs it. Big time. I'm a veteran.
Amputees,
And,
what have you.
oh, just a little bit of everything. So with all your support, we're going to make it happen, and I think it will. It's just too good to be not work. So
This patient had to be, I was treating for sciatica when she came in, and I first got the machine and I learned from Dr. Kim, this helps everything, eyes and stuff like that, and I said, she had gone to a ophthalmologist 9 years prior to that. He put the drops in the eye to dilate them. 1 or 2 days later, I'm not sure, she has central vision blindness. She could see peripheral a little bit, but nothing in the center. Been that way for 9 years. She was very apprehensive about it. I said, "Try it. You got nothing to lose." She tried it. That was a Friday. She called back maybe 4 or 5 hours later and said, "I think I can see some fuzzies." That was on a Friday. She came in Monday and took her treatment. Wednesday she came in and she said to my wife who was sitting at the desk, "You have a chain on with a cross, your eyes are brown," and read big letters off the front of the desk after her 3rd treatment. You can't do that with peripheral vision. Unless a guy's got a chain on this big or something like that. She had a very fine chain on. It encouraged me so much when that happened. And like I say, it's the things that people don't tell you that they have, and it takes care of it. I'm going to use the eye, for example. I had a lady in not too long ago, she'd been a patient of mine for 30 years. She had some surgery on her knee when she was in Florida. It was still swollen, so we were using it there. And she said, I've had this eye infection for 2 weeks now, and I've used the drops, and nothing seems to be happening. She said, will this machine help? I said, nothing to lose, let's try it. Then she took 2 treatments. She goes back to her ophthalmologist, and he's going to check her pressures. Now, the woman did not tell me she had glaucoma. I did not know this. Comes out, what have you been doing? Why? Your pressures are 15 and 16 or 14 and 16, and they had been 27 and 28. It's things that install my faith in this machine, because it's what the patients don't tell you, and it heals by other people's tests, not your tests. When they go to the ophthalmologist, measure the pressures, whatever, you know. It's just so exciting for me, you know, when it takes care of things that they didn't even tell you they had. You're treating for a shoulder, and I couldn't move my thumb for 3 months, and all of a sudden their thumb is moving like this, like Dr. Gordon says. It goes where it needs to heal, and I discovered that too. I'm treating a guy's shoulder, his right thumb's going like this, and his left thumb is going like this, and I'm thinking, what the heck happened? This is 3 months after I had the machine. So he got off, he said, I feel some better. I said, we're going to need some more treatments, and he says, oh my God, he said, I haven't been able to do that in 2 years. He had injured it somehow, and he was able to do this, but well, like I said, in the machine, this one was doing this, and the left one was jumping up like that. So it's things they don't tell you, and this machine handles.
My wife's sister, Sandy, had, she's a recovering cancer patient. She had rectal cancer, and she's recovering from that. But after the episode with the rectal cancer, she started developing a lesion on her ear. And she went to the oncologist and said, oh my God, your cancer's back. So what she did, that's about half past some of these around. Back in '07, she had the Mohs micrographics that you talked about. Well, they'll go in and they'll take a little layer, and they'll go in and put it in a microscope, and if it still has cancer cells, they'll go back and take another layer, another layer. Well, she did that for several times until finally got to the point where there wasn't any cancer cells that showed up on the microscope, so they thought she was good to go. I think I'm going to pass some of these pictures around here. You can copy them. And you can see this is back, the pictures were taken pre and post. It looked pretty ugly. Well, actually, after a while, it started to look pretty good, cleared up. And she'd had a stroke, another story, but she recovered from that very well. But we were home caring for her. And some of the conversations she had with us was that it seemed like it was coming back. It started to get purple again. And she would lay on it at nighttime, and she'd have a lot of pain with it. She couldn't lay on her right side. And just about this time is when I was getting acquainted with the PEMF machine, and we decided to start coming out to Dr. Kim, and he started treating her for the stroke and going with the loop over her head and whatever. And after a couple, 2, 3 treatments, we started noticing her ear, the purple color was going away, and she started to become more flesh colored. And this was pretty remarkable. And here's the other night, she's still staying at home with us, and I was walking through the bedroom, going to our restroom. She's sharing our room, but she's laying on the right side. And then I came back and I told Dee, I said, you know, your sister's laying back on the right side. She said she could never do that before. So she went back in the room, kind of nudged her. She was just half asleep. She said, Sandy, you're laying on your right side. She says, you don't have that. Well, no, I haven't had that pain in a week. I've had no pain in my right side. I've been able to lay on my right ear. And you have a picture of
yeah, I just got this on my phone. I took it in and she was in, but I'll pass this around a little bit.
Yours back to natural
But
color.
it just healed up. It went away.
She has no pain.
Just pass that around a little bit, Tom.
Now, she hasn't been back to the oncologist, but I'm sure she's probably healed. We're not even going to question whether or not it's better or not, but it's an amazing thing.
You lost him? These newfangled gadgets.